Regional government MPs say that they're sitting ducks and that under your roadmap to reopen at 70%, their vaccination rates are far lower and they want non-essential travel. Sydneysiders going on holidays, they want them banned from coming to the regions. Are you willing to do that?
Look, we're always looking at what we do in terms of regional travel at 70%, and I think we mentioned that we'll look at what the case numbers are doing at that stage. But it's important to note the most recent update I had told me that there were only 7 LGAs that haven't achieved the 70% first dose, and obviously we're working very hard between now and the next few weeks to get all communities up to at least that level. But from what I understand, the briefing I received a week ago was there were about 26 local government areas that hadn't achieved 70% first dose, and then in a week that's gone down to just a handful. And whilst we appreciate all those concerns expressed by people, we will make the cautious decisions based on the health advice, and we'll make those decisions as we approach that 70%. But no doubt, as we know, as the Doherty report says, depending on the number of cases, will determine how mobile we can all be outside of our own areas, outside of Greater Sydney for our Sydneysiders, and we'll take that approach as we have on most things in a cautious and considered way.
On 80% vaccination rates among Aboriginal communities and people on the NDIS are lagging behind the general population by up to 15%. How confident are you that it's going to be safe to open up at 70% when some of the most vulnerable in the community won't have met that benchmark yet?
Well, as you know, the Commonwealth Government was responsible for vaccinating those vulnerable populations, and we've stepped up in New South Wales, found where the gaps are and engaged at a very local community level. So we knew the Commonwealth was in charge of those things, but as I said, New South Wales I think was the first step to put up our hand and say we want to help, we want to support our vulnerable communities. And I think on a number of occasions, whether it's Dr. Chan or myself or the Minister, we've said on a number of occasions that when we do start opening up, we don't want to leave anybody behind. We want to be proactive as we social services on the ground about what communities are going through, what they're experiencing and what their attitude is. And it's fair to say that some communities who were initially fearful about getting the vaccine are now more enthusiastic about it. But it has been a day-by-day, community-by-community, town by town, suburb by suburb approach. We don't want to see anybody left behind. We want to make sure everybody not only is well informed but has access to protect themselves and their loved ones. And we also appreciate that in some, not many, but in some pockets of community, there are people who are still concerned, and our job is to make sure we provide as much information as possible and bring forward everybody together as much as we can. Yeah, look, we're considering what things look like at 80% imminently. We've been doing some very good work already. And, you know, the big question for us is not only what can vaccinated people do at 80%, but at what stage do we allow those that aren't vaccinated to participate?